In healthcare, nurses are vigilant guardians of patient well-being. Amidst vital signs and medication rounds, lab tests are crucial for patient assessment. These tests provide insights into the human body, aiding in diagnosis, treatment, and management. Lab values, though complex, are essential for nurses to understand. Each value corresponds to a specific component of bodily fluids, indicating potential conditions. Lab tests detect infections, monitor chronic illnesses, and guide medication dosages. Imagine a patient with fatigue and dizziness. A blood test reveals low hemoglobin, indicating anemia. This alerts the medical team to possible internal bleeding, prompting further investigation. Without understanding lab values, critical clues could be missed, leading to delayed diagnosis. Lab values are vital in chronic disease management, monitoring disease progression and treatment efficacy. For example, monitoring blood glucose in diabetic patients prevents dangerous fluctuations. Lab tests empower healthcare providers to make informed decisions, ensuring safe and effective care. In essence, lab values are indispensable in modern medicine. They provide a window into the intricate workings of the human body. Nurses play a crucial role in interpreting these values. Understanding lab values is key to delivering quality patient care. Nurses are at the forefront of patient care, recognizing the importance of lab values. They collect specimens, relay results, and explain findings to patients and families. A strong foundation in lab value interpretation allows nurses to anticipate complications. Recognizing a decline in hemoglobin levels, a nurse alerts the physician. This skill enables nurses to provide patient-centered care. Understanding lab values equips nurses with the skills to provide safe, effective care. It empowers nurses to make informed decisions. Ultimately, it contributes to improved patient outcomes. The complete blood count, CBC, is a cornerstone of medical diagnosis. This routine blood test provides insights into a patient's overall health. The CBC quantifies and characterizes blood cells. Key parameters include hemoglobin levels and white blood cell counts. White blood cells are the body's immune defense system. Elevated white blood cell counts signal active infections. The CBC includes red blood cell indices, crucial for diagnosing anemia. These indices reveal the size, shape, and hemoglobin content of red blood cells. The mean corpuscular volume, MCV, indicates red blood cell size. Low MCV suggests microcytic anemia, often caused by iron deficiency. High MCV indicates macrocytic anemia linked to vitamin B12 or folate deficiency. The mean corpuscular hemoglobin concentration, MCHC, measures hemoglobin concentration. Low MCHC indicates hypochromic anemia, often due to iron deficiency. Analyzing these indices helps pinpoint the type of anemia. Treatment varies based on the type of anemia. Iron deficiency anemia requires iron supplementation. Vitamin B12 or folate deficiency anemia needs respective vitamin supplementation. Understanding these indices guides effective treatment. It ensures tailored care for anemia patients. This knowledge is essential for healthcare providers. The CBC provides information about white blood cells and platelets. White blood cells are categorized into types, each with a specialized role. Neutrophils respond to bacterial infections. Lymphocytes target specific pathogens, including viruses. Platelets are responsible for blood clotting. Low platelet count increases bleeding risk. High platelet count may indicate inflammation or bone marrow disorders. Assessing white blood cells and platelets aids in diagnosing conditions. Electrolytes are essential for maintaining the body's equilibrium. The Basic Metabolic Panel, BNP, measures key electrolytes. Sodium regulates fluid balance and nerve impulse transmission. Potassium maintains cellular function, especially in nerve and muscle cells. The BNP ensures electrolytes are present in the right amounts. Sodium acts as a gatekeeper for water flow across cell membranes. Potassium balances sodium, ensuring smooth nerve impulses and muscle contractions. Electrolyte balance is crucial for optimal health. The kidneys filter waste, maintain fluid balance, and regulate blood pressure. The Basic Metabolic Panel includes tests for kidney function. Blood urea nitrogen and creatinine are key markers. Elevated levels indicate kidney dysfunction. These markers act as warning lights for potential problems. The BNP includes bicarbonate, crucial for acid-base balance. The kidneys regulate bicarbonate levels. Abnormal bicarbonate levels indicate acid-base imbalances. These imbalances affect organ function. The BNP provides valuable insights into kidney health. Nurses use this information to guide patient care. Understanding kidney function is essential for maintaining health. This knowledge is vital for patient management. Glucose is the body's fuel, powering cellular activities. The Basic Metabolic Panel measures blood glucose levels. Maintaining glucose levels is crucial for health. Insulin and glucagon regulate blood glucose. Elevated glucose indicates diabetes, leading to complications. Low glucose causes symptoms like confusion and weakness. The BNP's glucose measurement alerts to imbalances. The liver, a chemical powerhouse. The liver performs over 500 vital functions, acting as a chemical factory and waste disposal unit. It synthesizes proteins, detoxifies the bloodstream, and stores essential nutrients. Liver function tests, LFTs, assess its performance and health. Section 2. Liver enzymes. Sentinels of hepatic health. Liver enzymes are sensitive sentinels, raising alarms when damage occurs. ALT and AST are key enzymes, with ALT being liver-specific. Elevated levels indicate liver conditions like hepatitis. Bilirubin, a yellow pigment from red blood cell breakdown, offers clues to liver health. The liver converts bilirubin for excretion in bile. Elevated bilirubin levels signal potential liver issues. Jaundice is a yellow flag for liver dysfunction. Our exploration of lab values now leads us to the intricate world of coagulation, the body's remarkable ability to stem bleeding and repair damaged blood vessels. Imagine coagulation as a highly skilled team of first responders, always on standby, ready to rush to the site of an injury and quickly patch up any leaks in our intricate network of blood vessels. This complex process, involving a cascade of enzymatic reactions and a cast of specialized cells and proteins, is essential for maintaining the integrity of our circulatory system. Maintaining the right balance in coagulation is crucial. Too little clotting and even minor injuries could lead to excessive bleeding. Too much clotting and blood clots could form inappropriately, potentially blocking blood flow to vital organs. Think of coagulation as a delicate balancing act, like walking a tightrope, where even slight deviations from the center can have significant consequences. Coagulation studies, a group of specialized blood tests, provide valuable insights into the body's ability to form clots, helping healthcare providers identify individuals at risk of bleeding or clotting disorders. These tests measure the time it takes for blood to clot under controlled conditions, providing a window into the intricate interplay of clotting factors, enzymes, and cellular components involved in this vital process. Understanding coagulation studies is essential for nurses caring for patients with a wide range of conditions, from those on anticoagulant medications such as warfarin or heparin, to those with liver disease or inherited clotting disorders. By interpreting these tests accurately, nurses can contribute to the safe and effective management of these conditions, minimizing the risk of bleeding complications and optimizing patient outcomes. Prothrombin time, or PT, assesses the extrinsic pathway of coagulation. It measures clotting time after adding tissue factor and calcium. PT is crucial for monitoring warfarin therapy. The INR standardizes PT results for consistent monitoring. Section 3. Activated partial thromboplastin time, or APTT, assesses the intrinsic pathway. It complements the prothrombin time test for a comprehensive coagulation assessment. The APTT test measures clotting time after adding specific reagents. Prolonged APTT can indicate clotting factor deficiencies or other conditions. Thyroid function tests, or TFTs, are used to decipher the body's metabolic regulators. The thyroid gland influences our metabolic rate and overall well-being. TFTs assess the thyroid's performance, identifying hyperthyroidism or hypothyroidism. TSH instructs the thyroid to release hormones. Markers of inflammation and heart function, CRP and BNP. CRP signals inflammation, while BNP indicates heart failure. Elevated CRP suggests inflammation, and high BNP points to heart failure. Integrating lab values into nursing practice. Understanding lab values guides our assessments and interventions. This empowers us to advocate for patients and ensure appropriate treatment. Embracing lab knowledge enhances patient-centered care.